Good day. My name is Vince Gaudiani, and I do cardiac surgery in Northern California and have for 25 years. Today I'm at California Pacific Medical Center in San Francisco, and we're going to talk about how to avoid meeting up with me in a professional sense, or what can you do to stay in good health so you won't need a heart operation. And over the past few months, we've made several videos to try to explain something about heart surgery to you. And this topic for today is atherosclerosis, that is coronary artery disease. Now, this is a disease that's basically a chemical disease that causes cholesterol to build up inside arteries. And when they build up, when the cholesterol builds up, it can block the flow of blood and cause a heart attack. There are many medical treatments for this. There are many interventional treatments performed by cardiologists, and the last bastion of treatment is coronary bypass, and actually there's a video on the web that you can find quite easily about what that operation looks like. But today what I wanted to do was to try to give you some ideas about how to avoid either getting this disease or having it become so serious that you need an operation. And if you've already had an operation, perhaps this next bit of information will help you avoid requiring any more surgery. So we're going to go through a series of slides and try to show you some of the basics about coronary artery disease that you may not have had the opportunity to learn before. Remember, though, if you have specific questions about this, please talk to your own doctor, or you can email us. Our email address will be at the end of this talk. Now, the most important thing to understand about coronary disease is that it's a genetic disease in large measure. That is, you inherit the likelihood of acquiring it from your parents. So we jokingly say the best way to stay away from me is to have the right parents. And when we talk about the right parents, we're not talking about wealthy parents or nice parents. We're talking about parents who have the correct, what we call lipid profile. And we'll explain that in the next few minutes. Cholesterol is a small molecule that is a part of every cell in your body. And therefore, all animals make cholesterol in their livers, and any animal that eats other animals, as we do, will ingest cholesterol. So the important thing to understand about it, though, is that cholesterol absolutely does not dissolve in water. If you put cholesterol crystals in a tub of water, they'll sit up on the water just like a ping pong ball would sit in a tub of water. So therefore, it would be impossible for cholesterol to get around in our bodies if it had to travel alone, because it wouldn't dissolve in this bag of water that we really are. So the first question to ask is, well, how does it stay in solution? How does it stay in our watery circulation when it doesn't dissolve in water? And the answer is that we have a series of proteins that are about 1,000 times as big as a cholesterol molecule. All proteins are larger than cholesterol molecules. And these proteins can grab a hold of cholesterol molecules and basically drag them underwater, drown them, so that even though the cholesterol molecule itself won't dissolve in water, when it's attached to these lipoproteins, which means fat protein, lipo is the Latin word for fat, these proteins that are specifically designed to take care of cholesterol molecules and other fat molecules, they basically drag them underwater and keep them in circulation. And you can work this out in your own kitchen if you want to see the basics by taking olive oil and vinegar, and if you shake them together, you'll notice that they immediately separate, and the olive oil sits on top of the vinegar. So if you crack an egg into the olive oil and vinegar mixture and then shake the whole mess up, you'll find that the olive oil and vinegar will mix, and that's because the proteins in the egg grab a hold of the fat molecules and just basically drown them in the vinegar. Now, the protein that's present in an egg is just nowhere near as sophisticated as this group of lipoproteins that we each inherit from our parents that allow us to metabolize fats, that is, to take fat out of our intestines and bring it to our liver and move all kinds of fats that don't dissolve in water, including cholesterol, around our body. But we have a special set of proteins that do this, and they are quite efficient. And these are called, as I indicated, lipoproteins. And the lipoproteins are a complex series. They're not just one of them. And so you'll hear people talk about the good cholesterol and the bad cholesterol. Well, what they mean is that if you take the lipoproteins and you spin them at very, very high speeds in a centrifuge, they have different densities. And the high-density lipoproteins, the lipoproteins that go the farthest out in the centrifuge when they're being spun, this is a chemical test, are called high-density lipoproteins. And these actually help keep cholesterol away from your artery walls. And the lower density, or LDL, low-density lipoproteins, actually have more of a role in, if you want to think of it in a simple way, pushing the cholesterol into your arterial wall. And in fact, there's variability in each of the HDLs and LDLs, that is the high-density lipoproteins and the low-density lipoproteins, so that exactly the mix that you inherit will determine how likely it is that the cholesterol that you have to carry around gets stuck in your artery wall. And the exact pattern of this is called your lipid profile. Now, the more HDLs we have and the less LDL, the more favorable in general our lipid profile is. The LDLs are a powerful predictor. The low-density lipoproteins, exactly the ones you get, are the most powerful predictor of whether you'll develop coronary artery disease. So if you inherited a pattern of LDLs from your parents that are favorable, that are less likely to deliver cholesterol to the artery wall, then you'll be less likely to get atherosclerosis as you get older. And if you happen to get lots of LDL and of the wrong type, you'll be more likely to get atherosclerosis as you get older. So now you understand why getting the right parents is so important. And by the way, when we talk to patients who frequently bring their 30-year-old children with them, we encourage those children to have their lipoprotein studied to find out if they are candidates at high risk, so they can begin the process of avoiding the deposit of cholesterol in their artery wall at an early age, which is another way to stay away from me. In general, then, most patients who develop atherosclerosis, if you measure their cholesterol levels are fairly normal. It's not that everybody who gets coronary artery disease has high cholesterol levels. That's not true. Most people who develop coronary artery disease have normal cholesterol levels, but they have abnormal patterns of carrying the cholesterol around. That is, their lipoproteins are abnormal. And so it's important to understand that cholesterol, although it's the thing that you hear about in terms of your diet, and it in fact is important, is not so important as exactly the kind of lipoproteins that you get. Of course, if you have a high cholesterol, and there are patients who inherit abnormally high cholesterols, that is, they make more cholesterol than they need to, and their parents probably did too, these people are also at high risk for coronary disease, independent of whether or not they have odd lipoproteins. So what can you do to change this? Suppose you have parents who did get coronary disease early. One of the things you can do is to exercise, because it's been fairly well shown that when you exercise, your body changes the kind of lipoproteins that you make. It alters the mix of lipoproteins so that there is a higher level of HDL in people who exercise a lot and lower LDLs, and that by itself is help, because as you remember, the HDLs are likely to keep the cholesterol away from the artery wall, and the LDLs, or low-density lipoproteins, are more likely to let it get into the arterial wall. Now, it's also important to know that you can reduce the likelihood of getting coronary artery disease by having less cholesterol in your system. And the first way to do that, of course, is by diet. All animals make some cholesterol. Mammals make the most, so steaks and meats have high cholesterol levels. Birds, chicken, etc. has less. Fish has even less, and of course vegetable material has virtually none. So one strategy then, independent of whether or not you got the right lipoproteins from your parents, is to have a low cholesterol level. And a low cholesterol level can be had by having a low diet, and also by reducing the amount of cholesterol that your own liver makes. Now remember, your liver makes cholesterol because it's part of our cell membranes, and so it's an important chemical, but we can do with a lot less than we make. And there's a set of medications that are generally called statins, and the statins actually block the assembly line that makes the cholesterol molecule in your liver. So you can eat less cholesterol, and in addition, you can